Hey you guys, so in today's class we are going to be going over chapter 5, which is talking about eye health and diseases of the eyes, okay? The eyes, the eyelids and eyelashes, stages of eyelash growth, other disorders and diseases of the eye, and dealing with special eye health issues. So please make sure that you are following along with me. So I hope you have your book out and you are ready to get started. So here we go. When we first meet a person, we are immediately drawn to his or her eyes. We say the eyes are the windows to the soul. We feel we're communicating honestly and most effectively when we're looking at someone in the eyes. Eyelash extensions enhance the overall beauty and appeal of your client's eyes. To give your client the best possible experience, it helps to understand a bit about the anatomy and physiology of the human eye. Since we strive to work within strict professional health guidelines, it's critical to know some common conditions and diseases that affect the various parts of the eye. Note: this information is not substitute for professional medical consultation. Only a qualified doctor should diagnose and treat the conditions this chapter discusses. If customers present any symptoms described in this chapter, please urge them to see their physician. Here we go, you guys. Page 42 at the very top. The eye, eyelid, and eyelash. When you see a client for the first time, you want to assess the health of the entire area of the eye, not just the eyelash. You also must check the eyelid and cornea for any disease or potential complications of any lash procedure. We begin with conjunctiva. Learn to recognize common diseases and disorders of the eye for the health of your clients, the health of all your customers, and for your own personal health and safety. The conjunctiva is a thin, clear, moist mucous membrane. It coats the inner surface of the eyelids and the outer surface of the eye. The bulbar conjunctiva is the large white area of the eye. The inside lining of the eyelid, seen more easily when you pull the eyelid slightly away from the eye, is the palpebral conjunctiva. Both parts serve as a protective membrane that lubricates the eye and prevents microbes from entering. The conjunctiva can become inflamed due to an allergic reaction from seasonal irritants, chemical compounds, prolonged UV light exposure, and conjunctivitis. The blood vessels enlarge, turning the normal white surface red. This condition is commonly known as conjunctivitis or pink eye. Bacterial and viral infections also cause conjunctivitis. A conjunctivitis infection can look like an allergic reaction. The difference is that with the bacterial infection, there is a white discharge. Okay, that's the difference. There is a white discharge and the patient has decreased vision. While allergic conjunctivitis is not contagious, viral and bacterial conjunctivitis, however, are extremely contagious. These forms of conjunctivitis spread by touching contaminated tools, materials, doorknobs, tables, and other surfaces, and then touching the eye area. Be sure to note the appearance of the conjunctiva before and after. That way you can determine if the client had a reaction to the chemicals or is merely prone to redness of the eye. Because it can take several days after your client becomes infected until she develops visible symptoms, treat every client as though she has infectious conjunctivitis each visit. The cornea. The cornea is the transparent covering over the iris, which is the outer circular part of the eye that gives us our eye color, okay? And the pupil, which is the smaller black center of the eye. It protects the lens and anterior chamber, the iris, and other structures. Its main purpose is to refract light and assist in focusing. The cornea functions like a camera lens. It sends clear images back to the retina. The cornea also filters ultraviolet radiation. The cornea has several layers and many nerve endings, which make it sensitive to touch. In fact, it is one of the most sensitive tissues in the body. It contains about 70 to 80 sensory nerves. This concentration of nerves signals the eye to keep any irritant from scratching and scarring the cornea. Such scarring can affect the cornea's transparency, therefore affecting how clearly a person can see. For example, if your eyelash starts growing inward, it can scratch your cornea. The highly sensitive cornea enables you to feel it immediately. If you remove the eyelash right away, the cornea will heal by producing its own healthy cells in 3 to 4 days. If the eyelash remains ingrown for too long, the cornea nerves will become desensitized. As a result, the deeper penetration of the cornea will fail to heal itself completely, causing corneal ulcers, which is a scarring and hazy spot on the cornea. Trauma, chemical injury, contact lenses, prolonged dry eye, and infections can cause corneal ulcers. Infective corneal ulcers results from bacterial, fungal, and viral infections such as the herpes virus. Corneal ulcers are extremely painful due to the exposed nerves. Symptoms include tearing, squinting, and vision loss. Anytime a client has a hazy spot over the cornea, the eye is red and bloodshot, urge her to seek medical treatment before you start any procedure. Because it lacks its own blood supply, the cornea gets nutrients from the tears produced by the lacrimal gland and form the aqueous fluid inside the eye. A healthy tear film is vital to the health of the cornea. Tears keep the eye moist, help wounds heal, and protect against eye infection. A lack of tears can cause dry eye syndrome, discussed on page 50. Dry eye syndrome can cause a scratchy or sandy feeling as if a small object is in the eye, a stinging or burning sensation, excess tearing that follows a very dry sensation, a stringy discharge from the eye, and pain and redness in the eye. Medication such as antihistamines, nasal decongestants, and antidepressants can also cause dry eye. Symptomatic conditions like lupus and arthritis may also dry the eyes. If your client describes any scratchy or burning sensations during the procedure, you can put a drop of over-the-counter artificial tears in her eyes to help alleviate the symptoms. Corneal abrasions. Corneal abrasions is a scrape or scratch on the cornea. Abrasions can be very painful and uncomfortable until the cornea regenerates itself. Corneal abrasions are probably the most common eye injuries. Topical medication can reduce discomfort. The cornea usually can regenerate itself in a few days without scarring. Symptoms of corneal abrasions include pain, redness, excessive tear production, and the sensation of a foreign object in the eye. Clients may complain that it feels as if there's a piece of sand scratching their eye. If you believe your client may have a corneal abrasion, have them seek immediate medical attention. The most common cause of corneal abrasion during an eyelash extension procedure is from the placing the under eye stickers too close to the lower eyelid, which is what I mentioned earlier in our previous chapter, which was chapter 4. Stickers and gel patches both tend to move closer to the eye when the client closes her eyes. For that reason, Place the stickers and patches slightly lower than the desired final position to allow them to ship upwards once the client actually closes their eyes. If the client complains of discomfort while you are applying the extensions, or if you notice excessive tearing, check the sticker to make sure it is not too close to the eye and sliding into the eye. Corneal abrasion often happens whether or not the client complains of discomfort throughout the procedure. Frequently ask if the sticker or patch feel comfortable to verify that it has not risen up into the eye and caused injury. Eye injury and infections affect how you handle a client while you apply eyelash extensions. Some conditions may require you to cancel the session and reschedule the appointment for another time after the symptoms relieve themselves. The eyelid. Of course, to discuss the eyelashes, we must consider the eyelid. The eyelid is a thin covering of skin that protects the eye. Its main function is to spread tears to keep the cornea and conjunctiva moist through continuous blinking. The eyelid also acts as a barrier to keep the eye from drying out during sleep. The eyelid and eyelashes act as a mechanical barrier to dust and foreign debris during the blinking reflex. At the edge of the eyelid are two glands, one at the end of the eyelash follicle and a large one at the back of the eyelid. These are sebaceous glands, also known as oil-producing glands, just below the surface of the skin. These glands produce the oily substance needed to prevent evaporation of the tear film. They also keep tears from spilling into the cheeks. There are about 50 glands on the upper eyelids and 25 on the lower. Most eyelid problems result from infection and inflammation of these two glands. They can clog in a similar manner to a pimple. A stye is a painful red bump on the eyelid when the C's gland is infected. Standard treatment is a warm compress and, if needed, antibiotics. A stye usually resolves in a week. A chylation occurs when the meibomian gland becomes obstructed and the usually clear oily material becomes opaque and greasy. It causes less pain than a stye, but it is a chronic problem that takes longer to resolve. If topical antibiotics fail to clear up the chylation, it must be surgically removed. Next we have, and here's an example, you guys, of what a chylation looks like. The inflammation of the lower eyelid due to the infection right here at the bottom. Blepharitis is another common condition. It occurs when the eyelid becomes inflamed. Symptoms include a burning sensation, redness of the eye, light sensitivity, red and swollen eyelids, dry eyes, and occasional crusting or flaking material on the eyelashes after sleep. Treatment usually consists of maintaining good hygiene and holding warm compresses on the affected eyelid to remove the crust. Chronic phlebitis requires treatment with antibiotics. For more on phlebitis, including special care for clients with symptoms, please see page 55. The eyelashes. The eyelashes act as a sweeper to keep debris from irritating our eyes. It also acts as a sensor, stimulating the blink reflex when it feels foreign objects close to the eye. Our eyelashes exist in a constant cycle of growth, rest, and loss. All three stages take place at the same time. A common eyelash disorder is matosis, a loss of eyelashes. Another condition is trichiasis. It's an ingrown of the lash which can scratch the cornea. You can correct trichiasis by plucking the affected eyelash, since it is often grown back as an ingrown lash. The client may need electrolysis or surgery to treat the follicle. Another condition is called ectropion cause the eyelid and lash to turn outwards. This usually happens to the lower lids. Another common condition, entropion, causes the eyelid to fold inward and the entire line of lashes touches the cornea. Both ectropion and entropion involves loss of elasticity of the eyelid tissue and requires surgery to correct the problem. The eyelash growth cycle. Eyelashes grow like other body hair, except that the hair cycle out every 30 to 60 days. Unlike the hair in our head, the length of our lashes is predetermined. We don't need to cut our eyelash hair the way we cut the hair on our scalp because the hairs reach its maximum length and then it dies and eventually shed and falls off. Eyelash hair develop in a cycle of growth, rest, and shedding. The natural ability of eyelash hair to continuously grow, rest, and shed allow us to touch up only the new growth every month. We never need to apply a new full set if we perform regular touch-up. Eyelashes constantly and quickly regenerate, eliminating the chances for extensions to damage the natural eyelashes as long as they are applied properly, right? By the time an extension could cause potential damage, the natural hair is ready to die and shed. We use this natural growth cycle to our advantage. We always match the size of the extension to the size of the natural eyelash. Long natural lashes get long extensions. Medium length lashes get medium extensions. Short growing lashes get short extensions. When the extensions match the appropriate size of the natural eyelash, the lashes last longer. They also look better and are easier to maintain. The three phases of the eyelash growth cycle are called anagen, catagen, and telogen, ACT. So let's start with the anagen, which is the growth phase, which is the baby phase. Anagen lashes are the smallest, finest, shortest, least developed eyelashes hair. They exist for up to 2 months, so never apply long extensions to these baby lashes. Applying long extensions to short growing eyelashes causes the extension to grow out so far that it may tangle, flip, or look unattractive and strange. Use short 8mm extensions on anagen phase eyelashes. There is still plenty of room for them to grow out and still look good while they are growing. Then we have the catagen, okay, which is the resting or transitional phase. The catagen phase is the end of growth and the beginning of the breakdown of the follicle. Catagen lashes are medium in length, texture, and diameter. The resting lash can sometimes remain in the follicle for up to 2 months before detaching and entering the shedding phase. Bond catagen lashes with medium length lashes, usually 10 or 12 millimeters, extensions to last through the end of the next phase of the growth cycle and look more natural. Some clients with short, fuzzy, or fine eyelashes may need an extension as short as 8mm for catagen phase lashes. And lastly, we have the telogen phase, the last phase. Telogen lashes are the longest, darkest, and coarsest eyelash hairs. During this final phase of the life cycle, the hair is no longer attached to the derma papilla. It sits dead in the follicle until it falls out. You may notice the occasional eyelash on the pillowcase, or one may come out when you rub your eyes. These lash hairs are dead and are simply waiting to shed because these eyelashes do not stay on the eyelids. And here's an example of the anagen, catagen, telogen, and then it returning back to the anagen phase on page 47. Because these eyelashes do not stay on the eyelids very long, we can bond very long extensions to them. These lashes are also generally long enough to support the weight and length of long 12 to 14 millimeter extensions. There is no concern about these long extensions growing out to ridiculous length or flipping around because the hair is dead and no longer growing. You guys, understanding the growth cycle is vital to achieving the best possible results. A look that is glamorous yet seems natural. As you learn the technique, you will find that the length of an eyelash extension you choose corresponds to the growth pattern of natural lashes. Now let's talk about other diseases of the eye area. Let's start off by talking about ocular rosacea. Ocular rosacea is a condition associated with rosacea, which is an inflammatory skin condition that affects around 10% of the population. Several types of rosacea present different symptoms, but the main symptom is inflammation or highly sensitive eyelid skin. Some cases may display broken blood vessels and acne-like bumps. Facial flushing with alcohol consumption commonly occurs. The cheeks, nose, and sometimes eyes display redness. Clients with symptoms of rosacea have a 50% chance of also having ocular rosacea. So symptoms of ocular rosacea include sensitivity to light, red, inflamed eyelids, and swollen eyelids, itching, burning, makeup sensitivities, dry eyes, a gritty feeling in the eyes, clogged sebaceous glands on the margin of the eyelids, conjunctivitis, and also blurred vision. In some cases, chronic inflammation of the eyelids and the hair follicle on the eyes can cause eyelash loss. If the lash extensions irritate their sensitive eyelids, clients with ocular rosacea are likely to experience their symptoms worsening. Rosacea is a common skin disorder. It is more prevalent in women. It usually affects people between ages 30 and 60. It occurs more frequently in people with fair hair, skin, and eyes. The type of people likely to seek eyelash extensions overlap with those of rosacea sufferers. Generally, the rosacea patient is like a middle-aged woman with fair hair and skin. Fair hair clients are more likely to seek out lash extensions to add definition to their light colored lashes and brows. Because of these similar demographics, expect to see about 1/10 of clients to display symptoms of ocular rosacea. This condition may worsen after you apply eyelash extensions. So make sure your clients are aware of that. If you indeed think that you have a client that has rosacea, these are all questions that can be on your client consent form and questionnaire. Many clients have such a mild form of rosacea that they don't even are aware that they have the condition until the lashes provoke symptoms around the eyes. Rosacea and ocular rosacea have no cure, but there are treatments to help control the symptoms. Clients who suspect that they may be suffering from this disorder should seek medical advice, preferably with a physician experienced in treating skin disorders. Family practice doctors who are not fully trained in specific skin disorders may not be able to distinguish ocular rosacea from other conditions such as phlebitis, dermatitis, allergies, or injury to the eyelid skin from the extensions. If you suspect you may have rosacea, see a dermatologist who is experienced in determining the various causes of phlebitis. All right, we are now on page 50 at the top. It is now going to start talking about dry eye syndrome. There are many causes and syndromes of dry eye syndrome. The main problem associated with this disorder is a lack of proper tear production or composition. The tear duct either fails to produce enough tears or the tears evaporate too quickly due to improper composition or physical problems with the eye. Healthy tears have 3 basic layers. If the eye produces any of these 3 layers in the wrong quantities, problems with dry eye syndrome can happen. Oil. The top oily layer of the tears prevent the water-based layer from drying out. If there are problems with the glands that produce oily tears, the water layer will dry out quickly. Phlebitis, rosacea, conjunctivitis, and other disorders cause the oil glands of the eyelid to clog. Water. The aqueous or water-based layer of tears is the middle layer. It is mostly water with a small amount of salt. This layer washes away foreign bodies such as pollen, dust, and other debris that can irritate the eyes. If the eye fails to produce enough of the watery layer of tears, the oil and mucus layer can combine to form a sticky, stringy substance. Eyes may feel irritated and uncomfortable. Mucus. The mucosal layer of tears is the bottom layer, closest to the cornea and the conjunctiva. Mucus is mainly protein. This layer holds the three layers of tears together and prevents the two top layers from sliding off. If this layer is deficient, tears may not cover areas of the eye properly because there is nothing to hold the two upper layers to the eye. Allergies, conjunctivitis, and other disorders can cause overproduction of this layer. Mucus sometimes collects in the inner corner of the eye, especially during sleep. If a client seems to produce excessive mucus or complains of waking up with her eyes crusty and stuck together, have her consult a physician. The three components of tears must be in balance to prevent dry eye syndrome. Many health conditions and medications cause dry eye syndromes. Menopause often results in decreased production of tears. Symptoms of thyroid disorders often alter tear production. Allergy medication, oral contraceptives, and blood pressure medication can cause dry eyes. Many treatment options are available from over-the-counter moisturizing drops to prescription medication. If you suspect that your client may suffer from dry eye syndrome, suggest that she see a physician or optometrist trained to treat dry eye syndrome. Cosmetic surgery on the eyelids, blepharoplasty, can cause dry eye syndrome. If the surgery removes too much skin from the upper lids, the eyes may not shut properly. This can cause tears to evaporate. Removing too many under eye fat pads can also cause the lower eyelid to droop and roll outward. This drooping can prevent the upper and lower lids from forming a tight seal when the eyes close. Next page, we are now going to start talking about eyelash mites on page 52. The Demodex mite is a microscopic creature that lives inside the eyelash, eyebrow, and facial hair follicles. It also lives inside the sebaceous glands associated with these hairs. Mites feed on dead skin cells, hormones, and oil. By burrowing head first into the follicle and anchoring themselves there with tiny scales. Generally, these mites do not cause any symptoms. An overgrowth of mites, however, can cause phlebitis. If too many mites burrow into the same follicle, the eyelash hair can become loose. This results in lashes that tend to slide out from the follicle very easily. Severe cases result in eyelash loss. Overinfestation of Demodex mites occurs more often in elderly and people with compromised immune systems. Improper eyelid hygiene often is to blame. Urge your clients, again, I repeat, urge your clients to cleanse the eyelid thoroughly and remove all makeup nightly. Some physicians recommend the use of prescription medication, while others prefer diluted tea tree oil, shampoos, baby shampoos, or a 50-50 mixture of tea tree and mineral oil to reduce mite infestation. Never apply straight tea tree oil on the eyelid because it will be very irritating, okay? Do not do that. Dilute it with another oil and carefully apply it to the lid, avoiding actual eye contact. If you suspect that you or your client has Demodex infestation, seek professional help from a physician experienced in treating phlebitis and other skin and eye conditions. You have to let your clients know that they have to wash their lashes every single day. Clients that refuse to do that over the simple fact that they think that it's going to cost them to lose lashes or for their lashes to fall off, they're absolutely not correct, and it can lead to them getting more lash mites, okay? And it is not good. Hopefully you guys do not have to experience that, but from the very beginning, you have to give your clients this knowledge of how important it is for them to cleanse their lashes, okay? Very, very crucial that they do that. Next, let's talk about contact dermatitis. Contact dermatitis is a skin reaction that results from exposure to an allergen or an irritant. Symptoms include redness, itching, swelling, pain, rash, and blisters, and oozing or scaling of the skin. One or all of these symptoms may be present. Allergens can be natural, such as pollen, or man-made synthetic chemicals. Irritants also can be naturally occurring or man-made and can be broken down into chemical irritants and mechanical irritants. Chemical irritants can be natural or synthetic and include all kinds of substances such as cosmetics, solvents, detergents, glues, right, adhesives, pollutants, plant-based extracts, and essential oils. You simply never know, you guys. Mechanical irritants cause skin reactions by coming in contact with the skin and rubbing, poking, scratching, pinching, pulling, or causing other trauma to the skin and inflaming it. Example of a mechanical irritant are elastic on clothing, tight shoes that cause blisters, a foreign body stuck between the teeth, or a grain of sand in the eye. These irritants can cause dermatitis that is not necessarily related to allergies. Improperly placed extensions, especially the thickest fiber extensions, you guys, can touch the eyelid and cause contact dermatitis. That is very true, and it can happen when you have loose bases, when you do not apply the extension correctly on the natural lash and you have a loose base. It can actually be sticking and poking the client, and it can become irritating. When extensions are placed too close to the skin or are touching the skin, the base of the extension can rub against the skin, causing irritation and discomfort. This is especially true when the extensions are loose at the base. Well, I should have just kept reading. I said the exact same thing. And can move freely, okay? They can scratch and scrape the eyelid during sleep. It's difficult to distinguish between mechanical irritation and chemical irritation and allergies. If all the extensions are scratching and scraping against the eyelid, if the irritation appears to be localized to one particular area and you find an improperly placed extension in that precise area, there is a good chance that the irritation is caused by physical trauma and not an actual allergy. That means that it's the extensions causing it, right? Chemical irritation can be caused by contact with lash extension glue, the remover, or even the under eye sticker. You will be surprised to how many clients are actually allergic to the gel pads, you guys. Again, if you cannot see a localized area touching any of these irritants, it can be difficult to distinguish an irritation from an allergy. Generally speaking, chemical irritation affects one particular area where the irritant meets the skin. Under a magnifying facial lamp, you can often see tiny dots of adhesive on the eyelid between the skin and the lash hairs. If these dots are isolated to one particular area of one eyelid, it is likely that a chemical irritation from the glue caused or aggravated the dermatitis. In sensitive individuals, okay, the adhesive on the back of the gel patch and under eye sticker can cause chemical irritation. This generally causes a reaction that takes that takes the shape of the patch localized to the under eye area. So you have to analyze if after you remove the under eye pad from your client and you notice that their skin is red in that area, then most likely they are allergic to the under eye pads, okay? So be very detailed and pay close attention to your client, all right? Now let's talk about ocular herpes. Most people suffering from ocular herpes experience inflammation, redness, and pain in one of their eyes. They may also complain of blurry vision or sensitivity to light. The same virus that causes cold sores and other forms of herpes can infect the cornea, the retina, and the uvea. Severe cases can scar the cornea, causing visual impairment and even blindness. Like other forms of herpes, medicine can treat the symptoms, but there is no cure. Ocular herpes can recur, most likely due to a failure of the immune system. Physicians treat any pain, inflammation, and fever with analgesics and antiviral drugs. Avoid contact with ocular herpes sufferers displaying physical symptoms. Okay, and here is an example right there. You guys, obviously, if you were to even see anyone with ocular herpes or anything that looks close to that, why would they even come in for eyelash extensions? Think about it. I know us reading all this can be like, oh my goodness, like, what did I get myself into, right? What am I doing? Now, we're talking, you may never see this in real life, right? You may never see it, but it is important for you to be aware. Therefore, you are cautious. Remember that you will be dealing with a lot of different people, and you always hope that clients are clean, that they're, taking care of themselves, that they know what is going on. And obviously, if someone does have ocular herpes, or obviously if you ever happen to see this, you are not going to service them. Again, you are not going to service them, but this is information that will come to use, and it is important for you to be aware of, okay? Take special care when working with clients who suffer from chronic bacterial or viral infections, you guys. Sensitive skin, seasonal allergies, or chemical sensitivities, all right? All right, let's move on to page 54, allergic dermatitis. Allergic dermatitis, yes, we're almost there, just hang tight. Allergic dermatitis. True allergic reactions differ from simple contact dermatitis caused by chemical or mechanical irritants. Allergies involve a specific and unique reaction of a person's immune system to an otherwise harmless substance. A substance that produces an allergy in one person may not produce the same reaction in another. That is true, because only the allergic person's body mounts an immune response to the substance. So for example, strawberries causes irritation and inflammation in some people, but for most of us, strawberries cause no problem, right? They only irritate those who are sensitive to them, whose immune system produces a histamine response. You can often distinguish allergies to eyelash extension products from non-allergic dermatitis caused by chemical or mechanical irritants. True allergies to lash extension adhesives tend to display as diffused, evenly spread redness, itching, swelling, and discomfort. Usually, both eyes are involved and redness covers the entire lash line or the entire eye area. Reactions restricted to one localized portion of one of the eyelids are usually not an allergy. Allergies to eyelash extension adhesives can develop at any time. If the client has had some previous exposure to the allergen without noticing an allergic response, she can still react the next time you apply the extension. So what it's basically saying is, if you service someone, great service, there was no type of reaction, didn't have any reaction to the extensions, to the glue, but there is still a possibility that they can become allergic at some point. It may happen the second time, the third time. I mean, I've seen it happen to where a lot of my girls are like, I've been using the same glue, nothing has changed. And then at some point, their clients become allergic to the glue. So you just never know, okay? It says, even clients who have been wearing extension for years can suddenly develop an allergy to the adhesive. If the client has never had previous reactions and want to continue wearing the extensions, make sure that the chemical or mechanical irritant is not causing a reaction before she decides to proceed to stop. Another potential source of allergies is latex gloves, okay? Allergy to gloves usually show up as a rash on the forehead and eyes. Where the extension is, rest her hands while working. I'm just gonna be very honest. I do not use gloves while I am working. I'm not gonna say you don't have to. You can absolutely wear gloves if that is something that you choose to do. Obviously, we're gonna talk about infection control a lot more, but before you start lashing someone, you are going to properly hand wash your hands very well. Okay, and you are going to use hand sanitizer. Again, I know in this book it talks about the glove technique when it comes to for the glue, but we will not be using the glove. All right, you will be using a glue ring, and of course I will also give you the option of using a jade stone. It will be up to you. I want you guys to keep one thing in mind. The beauty of this industry is that there's so many ways to recreate the exact same thing, okay? I will be showing you my technique and my method, but eventually I want you to come up with your own technique and your own method, as long as you are keeping the following things in mind. 1, infection control, okay? Infection control is very important in this industry, that you're keeping in mind infection control. Obviously, that you are communicating with the client properly and that you are achieving the desired results, both that the client wants and that also you are happy with your own work. As long as you are able to do all of those things while still working in a timely manner, that is all that matters, okay? But infection control is very important. So whether you stick to my technique or you try it out and you find a different way, I hate to say I don't care. It doesn't matter. It doesn't matter the technique that you use, as long as you are doing the application clean, precise, you're keeping the integrity of the client's natural lashes in mind, you're keeping infection control practices at all times, and the safety of you and your clients. That's all that matters. Okay, I'm definitely not the type of instructor that says my way or no way. Absolutely not. I want you to feel very comfortable with your work and that you are giving each and every one of your models, your clients, the best that you can. Okay, so where did we stop? Prevent such a reaction by using non-latex vinyl or nitrile gloves. Some clients may be allergic to the rubber elastomer used to prevent crumbling and crackling in the adhesive. For this reason, try a fume-free adhesive on clients who experience allergy or irritation that cannot trace to a single area of localized mechanical or chemical contact. So you guys, there are adhesives, okay, glues out there that are for sensitive clients. Again, do some research, try it out. Just know that most sensitive adhesives, their retention is not very long. It could be only 2-week retention. So as long as you are aware of that and your client is aware of that. And by the way, you using a sensitive glue, for example, does not mean that the client is not still going to have a reaction. They can still become and be allergic to the sensitive glue that you are using. So these are all things that you have to keep in mind and you have to inform your clients of. Seasonal and environmental allergies. The eyelashes catch dust, allergens, debris, and any airborne particles that could enter the eye. For that reason, a client's lash extensions are likely to harbor a lot of environmental allergens such as dust, mold, pollen, and pet dander. Depending on the climate, some type of pollen can be present in the air year-round. You may notice that during time of peak pollen production, your clients feel more allergic to the glue than other times of the year. If the client is already suffering from mild allergies, Applying eyelash extensions can make red, itchy, swollen eyes worse. Discuss the importance of proper aftercare and hygiene with your clients, especially during allergy season. When you recommend aftercare products, emphasize that by the end of the day, her lashes are likely to be full of dust. That is why brushing the lashes at least twice a day is very important. You have to let your clients know that. Pollen, mold, and other allergens. Falling asleep with dirty lashes is especially risky for clients with allergies. Symptoms of seasonal and environmental allergies include sneezing, itchy or watery eyes, red eyes, nasal congestion, and sore throat. Okay, I have eyelash aftercare little cards available for you guys to give to your clients and models. Okay, you want to let them know what to do, what not to do, and how to take care of their lashes after their appointment. I will show you what those look like later. We're almost done. Special hygiene advice for clients with phlebitis and eyelid seborrheic dermatitis. So clients who suffer from phlebitis may choose to remove the extensions or keep them on. Often the process of removal is more irritating than the lashes themselves. The decision should be based on the severity of the phlebitis, the doctor's advice, and how much the client wants to continue using eyelash extensions. Many patients who suffer from phlebitis find it more comfortable and less irritating to treat the phlebitis without removing the extensions. Clients with phlebitis, allergies, or other sensitivities are poor candidates for thick extensions such as 0.25 millimeter lashes. Wow, yeah, that's a no. The thicker the fiber, the more stiff, wiry, and coarse they are. Thick, stiff extensions can rub against delicate, inflamed eyelid skin. They feel irritating and slightly rough to sensitive eyelids. Many phlebitis sufferers find that switching to 0.15 millimeter extensions reduce and even eliminates their symptoms. Always be sure that no extension touch a sensitive client's eyelid skin. A normal client may be able to tolerate extensions close to the eyelid, but the phlebitis patient must keep all extensions 1 millimeter or more away from her eyelid skin. Never let tiny drops of adhesive fall onto skin between the eyelash hairs. Repeatedly stand and inspect the skin between the eyelash hairs for tiny glue drops. Consider using special adhesive for sensitive eyes in phlebitis patients. Fume-free adhesives are best for clients. They are less irritating than more aromatic glues. Choose your gloves, glue, and other material carefully. Avoid causing a reaction or discomfort to an allergic or chemically sensitive client. Review. Familiarize yourself with eye health and common diseases of the eye. Safeguarding your health and the health of your clients is your most important task. Absolutely true. I 100% agree. You guys, I know this was a lot of information. I have additional videos that I will be making sure that you guys watch to help you get more familiar with eyelash mites, contact dermatitis, dry eye syndrome, all of these conditions, right? Eye health and diseases of the eye is very important when you are in this industry, and I want to make sure that you at least are comfortable with these and that you understand them. So this is a chapter, once again, that you have to go back and read so that you can become more comfortable. I am pretty sure you're going to get asked several things over this chapter on your state board exam, so let's make sure that we stay on top of it. One thing that I do want to point out is that in the very back of your book, okay, there is a appendix. Please use it. Look, phlebitis, and it shows you a picture. Conjunctivitis, also known as pink eye, like all of these, corneal abrasion, what it looks like. All of this right here has so many terms, and you want to review this, go over it. If you need to make flashcards for some of these terms, do that. Whatever you need to do to remember this information, I suggest that you do it. Okay, you guys, so that concludes today's class. I hope you found this information helpful. If you have any questions, you know how to reach me, but that's pretty much it for today. Don't forget to keep going, keep growing. I'll see you guys on the next one. Bye, guys.